Yesterday we had people guess what is going on with this patient, and so for those of you who didn't see it yesterday, this is a CT scan of a skull. This patient has what appears to be no frontal sinus. It just looks like there's a giant hole in their forehead. The answer to what this is this is a patient who probably should have had a type 3 brow bossing reduction, but ended up having a type 1 brow bossing reduction, not by myself, came to me for a revision. Remember, a type 3 is where I actually remove this bone, put it back on in a more recessed position. A type 1 is just burring it down. And while it may seem like, oh, I just want to have it burred down, that sounds more simple, the reality is that most patients need a type 3 in order to get the result that they want. Doing a type 1, just burring it down when the bone is thin, can result in something like this, where the bone gets burred too thin. And so here is a side view of this patient. This is their nose, here, eyes, this is the brow bossing. You can see in some places, well, it's hard to see, but the bone, there's a thin, like little eggshell of bone. The patient still has bossing, but now this bone is so thin, it's like an eggshell. And in other places, there's no bone at all, and the soft tissue, like the skin, is growing into this sinus. This sinus should be black and open. And so this is why I tell patients in consult that almost everybody needs a type 3 brow bossing reduction. I do get a CT scan to see, one, to make my plans for the cuts, but also to just double check that a type 3 is what's needed. But if a patient needs a type 3 to get a smooth contour, that's what I deliver, because trying to burr down a bone that's too thin can result in this, just a hole in the frontal sinus, and nobody wants to walk around like that.